Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out the top 200 drugs. It's a great study guide, great refresher, absolutely free PDF to use. That's at reallifepharmacology.com. Again, 31-page PDF on the top 200 drugs. I highlight some of the most important things you're going to see in clinical practice, as well as those things that frequently show up on board exams and pharmacology exams throughout your career. So go check that out, reallifepharmacology.com. All right, the drug of the day today is glycopyrrolate. This is an anticholinergic type medication. Where I've seen it used the most in my primarily geriatric practice is hospice type situations to help dry up secretions. The brand name of this medication is Robenal, which that brand name production has discontinued, I believe, but the generic is still available. So again, this medication, being an anticholinergic medication, works at muscarinic receptors. So it's a muscarinic receptor antagonist on smooth muscles. And ultimately what this does is it works on secretory glands, particularly in the mouth and the upper respiratory tract. And it essentially dries those up or can help with that. So in end of life, hospice type situations, you may see excessive secretions from a patient, and glycopyrrolate is one of the potential medications we could use to help with those secretions. Now, another one I see commonly used in practice, probably more commonly, is atropine drops to the mouth as well. So again, glycopyrrolate, another medication that works along the lines of atropine as well to dry up those secretions. Now, we do have the potential for other uses of this medication. I can tell you from my experience, I do not see these very often at all. One is hyperhidrosis, so kind of the excessive sweating potentially there. Another one, which now has been discontinued, I believe, the medication glycopyrrolate for COPD as an inhaled medication. That's another potential indication there as well. So again, primary use that I see glycopyrrolate used for is excessive secretions. We do have some numerous different dosage forms, from an oral tablet to liquid, those type of dosage forms. With that said, I'm typically seeing the sublingual liquid utilized, if anything is used there. Again, that's for those secretions. Many patients at end of life with those secretions, they may have trouble with swallowing pills and things of that nature, so that can definitely be a challenge there. Adverse effect profiles, probably what you would expect from any anticholinergic type medication. It can cause some constipation, and obviously what we're probably trying to do is dry up the mouth a little bit, but if we get too much, we can cause some excessively dry mouth. Some of the systemic effects are probably unlikely at the dosages we're going to be using to try to dry up those secretions. But in the case of, overdose, excessive use of the medication, remember that anticholinergics can cause hyperthermia. So that's that body temperature to go up. Can cause some cardiac problems like tachycardia, atrial fibrillation. Again, usually more so in excessive use in those type of things. And then, if you think of can't spit, pee, see, or poop, it can cause some urinary retention, definitely some constipation. It can cause some issues with dry eye, as well as potentially exacerbating glaucoma as well. So those are all definitely potential adverse effects with the use of this medication. If it gets into the central nervous system to a significant amount, it can also cause some confusion as well, it being an anticholinergic type medication. Pay attention to patients with glaucoma, may exacerbate that potentially. Again, at the low dosages that we're using, and probably in the hospice type situation that we're using this in, it's probably not going to be a major issue. But it is something that is there if you're using it for another purpose as well. And then there is, kind of a precaution warning with the use of potassium chloride oral dosage forms. So with the potential slowing of the gut, it could cause those potassium tablets to kind of stick and stop in the GI tract and increase the risk for that tablet getting stuck and basically causing some sort of a gastrointestinal ulcer. So that's an important one to remember there as well if you've got a patient who's taking potassium supplements there too. Monitoring parameters, obviously we're going to look if we're using it for reducing saliva production and drying up some of those secretions. We're going to monitor for that. That's going to be important, of course. Other things you can think about, maybe paying attention to heart rate, tachycardia, maybe paying attention to constipation and seeing if that's an issue there. Again, not something that we're, in an end-of-life situation, probably not something we're crazy worried about, but something to be aware of there in rare cases. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material, like BCPS, ambulatory care, geriatrics, BCMTMS, or the NAPLEX exam, go check out meded101.com/store. We've got tons of resources there that have helped thousands of pharmacists pass their board exam, and we can absolutely help you too. So again, go check that out, meded101.com/store. If you're a nurse, med student, pharmacy technician, meded101.com/store has tons of resources for you as well. Various books on Amazon, review course even for pharmacy technicians looking for their certification. Again, all those links, meded101.com/store. All right, wrapping up with drug interactions. So there are a lot of drug interactions potentially just due to the anticholinergic nature of the medication. In hospice and end-of-life situations where we may use this medication to dry up secretions, typically we're going to have many of those medications already discontinued. So that's a potential nice thing in that situation where maybe we don't have to stress too much about drug interactions. But I do want to go through them and make sure you're aware of them because there definitely are quite a few listed with this medication. So first off, I always think about anticholinergic medications and the combination effect of having additive anticholinergics on board. So if you've got a patient that's taking diphenhydramine for sleep, if you've got urinary anticholinergics on board, like oxybutynin, tolterodine, for example, we can have those additive effects, additive constipation, additive confusion, urinary retention, all those type of things can combine, and having two anticholinergics on board can cause those issues. On the flip side, if we're using a medication like an acetylcholinesterase inhibitor, like donepezil or rivastigmine, glycopyrrolate can directly oppose the effects and the beneficial effects of that medication. A couple other kind of rare things, I guess. Atenolol, digoxin, so a couple of cardiovascular type medications. You may see serum concentrations go up with those meds. Clozapine has some anticholinergic activity as well, so I'll mention that specifically as far as antipsychotics go. Can cause some additive type concentrations. Metformin for diabetes, you may see these concentrations go up modestly. And then thinking about the adverse effect profile of glycopyrrolate, I throw in opioid agonists, so your methadones, your morphines, your oxycodones. These can all increase the risk of constipation and really have that additive effect of glycopyrrolate as well. And then I alluded to the potassium supplements. So if we slow down that GI tract, there is some risk and evidence that we may increase the risk of that oral potassium dosage form, basically sticking, causing issues in the gut and potential ulceration in that situation as well. All right, well, that's going to wrap up the podcast for today. Thank you so much for listening. Hopefully you found this beneficial. If you did, please do me a huge favor, leave a rating review on iTunes or wherever you're listening. Greatly appreciate that. Share us, friends, colleagues, students, anybody who could benefit from some pharmacology education. And of course, if you have any questions, comments, feel free to reach out to me. Eric Christensen, PharmD, BCPS, BCGP. You can connect with me on LinkedIn or drop me an email, mededucation101@gmail.com. Thanks so much for listening. Take care and I hope you have a great rest of your day.